Coming up, our CEO series continues with the dig Howitt from Cochlear. Wages growth slows. What does it mean for the RBA? And the Chinese central bank injects some stimulus. That's all next. It's your daily 10-minute business and finance news wrap for this Tuesday, the 15th of August 2023. Later, we'll go into the latest figures from the Bureau of Statistics, which showed that wages growth is slowing. So what does it mean for the RBA? But first, to hearing implant maker Cochlear, which posted a full-year underlying profit of $305 million. That's up 10% on record sales. For more, I spoke with its CEO, Dig Howitt, about the future of the company and its new technology. So Dig, Cochlear supplied hearing implants to 15% more people this financial year. That's more than 44,000 people. What drove that?
A few things, Ricardo. Firstly, there's underlying market growth because there's just enormous need for our products that remains unmet. We've also gained some market share on the back of very strong products and a great technology portfolio. There's been a recovery in clinical capacity, both in surgeries and a little bit of expansion in audiology capacity. And we also saw some catch-up of surgeries delayed through COVID that we actually thought we'd already seen, but we did see some more come through last year. So 4 drivers, and really pleased with the strength of the growth.
I'd love to break down some of those drivers, right? You mentioned there's still this unmet need, I guess. What's being done to make it easier for people to access hearing implants?
Yeah, so this is the core of our strategy, that there are hundreds of thousands of people around the world, including in Australia, who have a significant hearing loss who don't get access to our products, largely because they don't know that they are candidates and the healthcare professionals that they are talking to often don't know the indications for cochlear implants. So our strategy is largely around building that awareness of our products, of the effectiveness of them, and also, very importantly, building out the awareness of the importance of treating hearing loss. Hearing loss is a medical condition that people don't see as a medical condition. They just see it as something that happens as you get old and you put up with it. And there's increasing amount of evidence that says it's actually a serious medical condition, and good hearing is essential for healthy aging. I mean, there was just a very recent study released in July that tracked people with hearing loss over 3 years. Half of them got hearing aids, half of them didn't get hearing aids, and tracked their cognition, tracked their brain function over that time. Now, at the macro level, there wasn't a difference in cognition across the 2 groups. But with people for higher risk of cognitive decline, those people who had hearing loss and got treated with hearing aids, their cognition declined by 48% less than the people who had hearing loss and didn't get treated. That's a strong indicator that hearing is really important in brain function and the health of our brains as we age.
A second point that you made earlier is that of catch-up in surgeries. Can you go into more detail about that? To what extent is there still more catch-up?
We think, it's really hard for us to tell what's catch-up surgery and what's not. So what we've got is a couple of things. One is we saw in developed countries an increase in the rate of growth in children. 5% increase in the children. Now, we normally expect that to be 1%, in line with about the birth rate. This 5% says 2 things. One of that is increase in market share because of our product technology. The other one is we do think there is some COVID catch-up. And as we talk to clinics, there are just some anecdotes of they're seeing some children that are a bit older, or some babies that are a bit older than normal, which suggests that they somehow got missed through COVID and newborn hearing screening in COVID, but fortunately now have been caught in the system. So it's very hard to tell how many, but we do think as we look around that largely cleared, particularly for children. But there are some waiting lists, in Australia, in South Australia and in Western Australia, there are still waiting lists for adults, not for children, for adults to get cochlear implants.
The past few times I spoke to you over the past few years, we were talking about the demands being made on hospital staff during the pandemic, right? To what extent do you think that has been alleviated?
So it's certainly improved. And first of all, I mean, hospital staff did, and frontline healthcare staff right around the world did an amazing job for all of us through the pandemic. And many, as a result of that, we're tired, we're worn out, we're looking for other jobs. So it was a clear dip afterwards in terms of the number of nurses, for example, people working in hospitals. What we've seen is a pretty good recovery of that capacity and of people working in hospitals particularly, and that's certainly underpinned a lot of the growth we saw in the last year, was just more hospital capacity being available. And so I think we're pretty confident that will now continue to grow into the future.
Final two questions. Technology obviously would be a big deal at Cochlear. What are the new exciting pieces of technology there? And how does Cochlear use artificial intelligence, AI, which seems to be the buzzword at the moment in corporate Australia?
Yeah, so on the new technology, I can't talk specifics because that everyone wants to know what we're doing, but we do spend 12% of our revenue in R&D, $240 million in the last year. And that's building a fantastic pipeline of new products where we aim to improve the hearing outcomes people get. We aim to improve connectivity. How easy is it to live with an implant? Does it seamlessly connect with your phones and TVs and other devices? But also part of this is once someone has a cochlear implant or acoustic implant, there's a lifetime of care that follows, which over time is a minimal number of appointments. But the more that we can monitor through our technology, the more we can reduce appointments that are just checkups and only have people go back in if there's a specific need. And that's a real opportunity for our technology. We've made some advances there already, and that's absolutely an opportunity for AI, is to use AI to help people adjust their implant system over time, to suggest adjustments, for example, which simplifies and reduces the cost of that lifetime of care and makes it much more convenient. People can get care at home without having to get an appointment. Now, as there should be with AI, there's a regulatory, or any new product, there's a regulatory process to go through, but that's one of the opportunities for AI. We also see great opportunities in our customer service, in providing help and tips for people, in knowledge management. We've got an enormous amount of clinical knowledge, as an example, around the world from people in all sorts of different circumstances and hearing environments. If we were better able to pool and access that knowledge, we could really help people even more with their hearing and provide it much easier to access. So we've got some great use cases for AI. We are starting working through those, but I think it's a very, very exciting future.
And finally, something I'm asking all CEOs this reporting season: what's your company's position on the Indigenous voice to Parliament? Why? And are you financially backing the campaign either way?
Okay, so we support the spirit of the Uluru Statement of the Heart. We have a reconciliation action plan. The primary focus of that action plan is Indigenous hearing health. There is a huge gap between the hearing health of Indigenous Australians and the rest of us, to the extent that Indigenous people are 3 times more likely to have a middle ear infection. Over 40% of Indigenous people over the age of 7 have hearing loss at some level in one or both ears. The consequence of that, particularly for children, is access to good education. If you can't hear the teacher clearly, how do you get a good education and all of the opportunities that come from life? So we are very focused. That's what we know. We are very focused on our reconciliation action plan in that area. And we think we can make a real difference working with others. As far as the voice goes, we are providing information to our employees to make an informed choice. We're encouraging people to make their own decision, and making sure that we do provide that access and information. And we are not providing financial support to either of the campaigns, but are putting it into education for our employees and, to the extent we can, in helping on Indigenous hearing health.
Ziggy Howitt there, the CEO of Cochlear. Now to some economic news, where the wage price index, according to the Bureau of Statistics, eased for the year, down from 3.7%, which was a 10.5-year high, to 3.6%. So what does that mean for official interest rates? Is it something the Reserve Bank would be pleased about? For more, I spoke with Pat Bustamante. He's a senior economist at St. George.
So these numbers, if anything, surprised on the downside, and they were a touch slower in terms of the quarterly growth rate compared to what the market and indeed the Reserve Bank itself was expecting. So the wage price index came in at 0.8% over the June quarter, and that was a bit lower than the 0.9% expected. So it really points to a moderation when it comes to wages growth in the economy. Which is counter to the risks that could eventuate from a tighter labour market and high inflation environment. But we just haven't seen that materialise. We haven't seen wages essentially chase higher prices. If anything, we've seen a moderation in wages growth, which would please the Reserve Bank.
It's still interesting, though, to see that while the proportion of jobs receiving a wage rise this quarter was slightly lower than the same time last year, those that did receive a wage increase, the average was larger than last year. Why? And what's that saying about the economy?
That's right, and that was both across the public and private sectors. We saw the proportion of jobs that received a wage increase fall compared to the June quarter in 2022. But those that did receive wage increases received a larger increase than compared to both the previous quarter and last year. And in particular, when you look at those receiving wages growth of above 4%, that ticked up over the quarter as well. So that's telling you, I guess, two main things. The first one is that maybe those skill shortages that were quite acute last year, and which led to businesses having to offer higher wages on a more regular basis to attract labour. Maybe those pressures are easing somewhat compared to where they were last year. And that's something that you'd expect given the high migration numbers and the high increase in labour supply, which is helping to fill those skill shortages. So that suggests that those acute pressures in the labour market is turning. And which is consistent with what the RBA has been saying as well, including in the minutes today, that the labour market has started to show signs that it's turning. So that was again would have been positive for the Reserve Bank.
What's the pace of wages doing to the rising cost of living? Because we know that inflation, the headline inflation rate, is at 6%, almost double that of wages, because some people are really doing it tough. So this slowing of wages, is that necessarily a good thing?
So I guess it depends on the perspective. So when you look at broad inflationary pressures across the economy, having sustainable wages growth at around that 3.5% to 4% mark is a good thing from a macro stability perspective, and it's something which the Reserve Bank governor has been talking about for a while now. But when it comes to individual households, it just shows the pressures that households are under at the moment. So in terms of what households consume, the consumer price index increased by, as you said, 6% over the year to the June quarter. Wages growth is only running at about 3.6%. So in real terms, wages are going backwards, and it just shows the extent of pressures that the households are under at the moment. So we've still got to, in terms of our forecast, we've still got to at least 18 months to go before we expect significant real wages increase for households across Australia.
What will ultimately drive those real wages increases?
So we're expecting inflation to keep on coming down over the next 2 years, and that would ultimately, if you combine that with sustainable and stable wages growth at around the level that we have at the moment, we're expecting after the September quarter, we're expecting the wage price index to go up to around 4%, but then come down to a more sustainable 3.5%. That's basically going to drive real wages growth, so sustainable wages and a reduction in at least headline inflation over the next 2 years.
And final question, Combine today's data, the wage price index data, with the RBA minutes that was also released today. We know that the RBA said that it did consider a 25 basis point increase at the last meeting, but ultimately decided on no change at 4.1%. What does this all mean for the future direction of interest rates?
So when it comes to the wages outcome, as I mentioned earlier, it was a touch softer than the Reserve Bank was expecting. At 0.8% compared to 0.9%. So if anything, there's a bit of downside risk there when it comes to the RBA's own wages and inflation forecast. So in terms of the minutes that were released today, the board did consider both a pause and a hike of 25 basis points. The board landed on a pause, as we all know. And I think there were three main reasons why they landed on that decision as opposed to hiking again. So the first one relates to what we saw in inflation a few weeks ago. So inflation came in a bit softer than expected. Not only did the headline number come in a bit softer than expected, but the makeup would have really pleased the Reserve Bank with some of those market services that seem to be sticky overseas, moderating in Australia. So that would have really pleased the Reserve Bank. And on the back of that, what the Reserve Bank's been saying for the last few months now is that the upside risk to inflation and the downside risk to the real economy are now much more evenly balanced. So maybe a quarter, 2 quarters ago, the upside risk to inflation were really kind of primary consideration which the board was informing its decision on. Now it's weighing up more evenly kind of the downside risk to the economy, because we've seen inflation come down. And we're also seeing households really start to pull back when it comes to retail spending. We saw that go back, for 3 consecutive quarters. So that's kind of the second consideration. And finally, the Reserve Bank has also made the point that there are long and variable lags associated with monetary policy. So even though if they stop tightening today, they're still kind of tightening in the pipeline, which is going to affect spending going forward. And particularly when you consider that a large share of households have fixed mortgages that are going to roll over onto variable rate mortgages, that's really going to continue to impose a tightening in the economy, even though they've paused rates. So when you put those three factors together, the minutes suggest that the case for pausing was much stronger than the case for hiking, and that's kind of where they landed. But they did warn that if risks become unbalanced and the upside risk to inflation increases, or there's an assessment that we're being knocked off that disinflationary path that we're on, that they will hike again. So that's warning. But at the moment, it seems like the economy is evolving in line with what they were expecting.
Pat Bustamante there from St. George.
Now, Market Day on the SBS On The Money podcast.
A very quick look at the Australian share market, which did rise today. The S&P ASX 200 up 0.4%, 7,305, and it comes after China's central bank lifted key interest rates there for a second time in 3 months. And it is an attempt to try to stimulate its economy, and followed some more negative economic news out of the country today. This SBS On The Money stream is provided for informational purposes only. The content in this stream should not be understood as constituting advice or a recommendation. It is not personal advice, and it does not consider your personal circumstances or objectives. You should contact a licensed professional before making any financial decision.